16-year-old boy was brought into the hospital in critical condition, having taken malaria tablet from a street side store. He died soon afterwards.
Within 12 hours on admission, he started deteriorating. His liver function test came out 50 times the upper limit. It was a needless waste of life. It was a big blow to the family. I saw how close the family was. Even now, years on, I don't know how they'll be able to cope with the loss of a boy at the prime of his life. This is a case that keeps me up at night, thinking of this life that could have been saved. It's a doctor's worst nightmare, actually. Fake medication, counterfeit medications can lead to death, can kill people.
One product, above all others, drew controversy during the coronavirus lockdown: Quacks.
Italy and Ivory Coast are some of the countries hoping to invest and investigate Quacks as a possible cure for coronavirus.
Although legally registered as a food supplement, the creator of the drug, Samuel Duncan, claimed on multiple TV stations it had treated infected patients in China.
We're talking about a possible cure for coronavirus. It's an international breakthrough.
Quacks sales boomed and social media exploded with tales of the so-called cure.
First two patients of the COVID-19 who were at the verge of death recovered after 5 days of administering the organic supplement.
We had a lot of testimony from people purporting to have been saved in different ways by this medicine, giving testimony upon testimony in WhatsApp group after WhatsApp group. It means that the effective controls on advertising that are in place in every civilized country, including Ghana, could not apply to them. They've turned a lot of our regulatory standards upside down.
This was not the first time Duncan had triggered a media storm.
The Quacks drug, since its introduction on the Ghanaian market, has been highly projected as a drug for curing HIV/AIDS.
And it's treating cancer cases, treating kidney failures, treating mass stroke, treating.
Under pressure from the FDA, Duncan issued a disclaimer on the 15th March, stating his product is not a cure for coronavirus.
So nobody should go out there and say the Center for Awareness Global Peace Meeting says they have found cure for coronavirus. It is not scientific and hence not conclusive.
But away from the TV cameras, we found evidence a core agent continued to market the supplement as a COVID-19 cure to customers in private, breaking FDA rules and misleading people into buying the drug for the company's profit. We went to the Quacks office in Accra to capture this behavior on camera. Kafui, a Qua store manager, assured us the products we had come to buy were genuine, safe, and from their own storerooms.
And I don't know, we have limited stock, so we prefer people come here directly and get it from store. They're on the safer side, but we don't know whether we find her.
When we asked Kafui if Quacks could cure coronavirus, he told us it can.
Say, yeah, brother, COVID, or no man, or the cure.
He gave us clear instruction on how to administer the liquid.
Corona and you're no direct. Corona and you're no direct. Okay.
Briefly, he removed his mask so we could see his face. Then it was time to pay. He brought us a bottle of the drug. When we asked how much should be given to patient, we were told all that mattered was money.
How many bottles now? So, they account. Once it's all about your funds, so which one?
3 days after this meeting, the FDA tested samples of Quacks and found them to contain the bacteria E. coli, which often derives from feces. The agency recalled all core supplements from the market in response. Our attention then turned back to the Abdallah brothers. In the days after our first meeting, they called us, encouraging us to purchase more coronavirus cures. They made increasingly sensational claims, telling us they were treating the vice president of Senegal's family, who they say were infected with COVID-19.
President, Senegal president, vice president.
It's impossible the Abdallahs actually contacted the vice president of Senegal. The role of the vice president does not currently exist in that country. We planned to meet the two brothers again to discuss a larger deal. They thought they had me on the hook, but little did they know I was not just another victim. I wanted to see how far their fraud will go. I wanted to see deeper into the mind of a scammer. They were staying in a remote house on the edge of Accra. What I found inside shocked me. More than 100 bottles of fake cure.
Very strong power.
Over the next few minutes, Dr. Abdallah Sr. began to boast of knowing some of the most powerful people in Ghana. He claimed he was doing a deal with the king of Ashanti, the Asantehene.
$150,000.
We spoke to the Asantehene and they told us these claims are completely false. It was all a smokescreen to try and impress us. The younger Abdallah told us he had given the drug to others and that they were sharing positive testimonies on social media. According to counterfeit medicine expert Bright Simmons, the COVID-19 pandemic has been a time of great opportunity for such social media quacks.
Today, a huge number of people get information about everything, including medical and health information on social media networks. We don't have a blueprint, we don't have a rule book of how you deal with misinformation at a large scale during a pandemic in an age of social media and an age where trust in established institutions and leaders is at an all-time low. That confluence of forces is completely unprecedented. It becomes very easy for a scammer, for a snake oil salesperson to quickly move into the breach.
Dr. Abdallah Jr. made it clear to us that their drug production strategy is designed to maximize profit during the pandemic. Then things grew more sinister. Dr. Abdallah Sr. did his best to persuade me he is a man of mysterious spiritual power. He claimed he is invincible. In his increasingly elaborate attempt to showcase his power, he even claimed he was responsible for the downfall of President Yahya Jammeh in Gambia. Then the talk turned to money. They demanded 150,000 Ghana cedis, over $25,000 for 100 bottles of their concoction.
150,000. 150,000 Ghana cedis. Okay.
Before leaving, he told me the number of coronavirus patients he was treating had expanded. They thought they had hit a jackpot, but we will never come back and pay for the drugs. We gathered all the so-called cures we had collected and took them to the Ghana Standard Authority. This is where prospective medicines are tested before going to the market. It's one of the best laboratories in Ghana.
And what brings you here this time?
These are various concoctions that we have collected, and we are here to test it. Testing the efficacy of drugs requires clinical trials. So instead, we submitted them for toxicology tests to check if the product contained any dangerous biological or chemical ingredients. After days of analysis, we returned to collect the results. All the concoctions failed to meet the standard for human consumption. Dr. Abdallah's bottles were contaminated with unacceptable levels of bacteria and mold. Further tests will be needed to determine what threats these contaminants could pose to patients. But depending on the dosage and how long the products are kept, they have the potential to cause serious illness, including diarrhea and other gastrointestinal symptoms.
There's the potential for the bacteria to multiply and then become much more dangerous to consume after a few weeks.
The sealed COA-FX samples contained levels of mold that were too high to be counted.
Humans should be able to tolerate low levels of these, but the fact that the test picked them up means that these were above the acceptable levels.
Both the COA-FX and Dr. Abdallah's samples were also flagged for containing phosphine, which, depending on the quantity, could pose dangers. We put our findings to the director of the FDA.
So far as we are concerned, there's no product that has been registered according to the laws of Ghana for cure for coronavirus.
Because of the potential dangers it posed, we showed her a bottle of Dr. Abdallah's concoction.
Some communication. Just by looking at the product, I can tell you it's not registered. FDA would never allow you to put this in your product, COVID Cure 1.
Shouldn't this ring a bell to Ghana? The FDA doesn't really care about it.
Of course not. Of course not. Of course not. The regulator's mandate is to protect public health and safety. If there's anybody out there and you are falsely putting a product on the market that it goes against the laws of the country, we have regulatory actions and we will come after you. Really, it is a very serious crime. And I'm not joking with this.
She told us the agency would take swift action against anyone selling unregistered medicines.
I'm actually sorry that we have not seen it. But as I say, we are not everywhere. And we, as part of our work, we rely on information. And you have just given me information. And whenever we're given information, we follow through.
Less than 24 hours after our interview, the FDA moved to shut down the production facilities of the Abdallah brothers. They had been on their radar for some time now. The agents found evidence of large-scale production, including almost 300 bottles of so-called COVID cures. Dr. Abdallah Jr. repeatedly tried to persuade the agent he was not selling these concoctions.
Well, we have not sold this thing in any way or the other. We have not sold them out to anybody.
Well, what you have here is in commercial quantities.
We made that in this quantity in the sense that we are waiting for when the approval comes. Well, we did not intend selling.
When asked to explain why a fake FDA number was on the labels, he had no answer.
Well, this number is TNPC number without FDA number. So that's a different one.
We sent our allegations to the Abdallah brothers, and they responded, claiming their product was for testing purposes only. and that they are taking steps to license it. They claimed they never said their product can cure coronavirus, despite it being labeled COVID cure. They also claimed they had never sold their concoction to anybody. Quacks and Samuel Ato Duncan did not respond to our allegations.
Cure for coronavirus. This is where we are. That is why we invited you.
After they had gathered all their evidence, the FDA brought the two Abdallah brothers in for questioning. The individuals exposed in this film do not represent the herbal medicine industry as a whole, which provides crucial services to many Ghanaians. Professor Gordon Awandare hopes herbalists and scientists can unite in rooting out the rotten eggs.
You have a few quacks there who they really do a disservice to the industry and to their colleagues, which is unfortunate because there may be some that actually are good. If we don't get rid of the fake ones, then you have a situation where people mistrust the whole enterprise.
At a time of global pandemic, we have a duty as journalists, as citizens, to fight fake medicines and expose the quacks that mislead us. I will always be watching.